Welcome to the Ashi Acupuncture podcast, sharing real techniques so you get real results. Here's your host, Eric Shanky.
Hi everyone, I'm really excited that I've got Tom Bisio on my website for an interview today. Tom Bisio is one of my heroes. He's written what I consider one of the best English language books on traumatology. It's a Tooth from the Tiger's Mouth. You got to get this book. I consider it a must read. Whatever you pay for it, it's worth 10 times that just to get the formula for trauma pills and trauma liniment. I've used trauma pills many times, I'd say in the last 10 years. They're like a miracle. I'm just really thankful, Tom, that you shared that with the TCM community. So effective. Thank you so much for being on the show.
Oh, it's a pleasure. Thanks for inviting me. And I'm glad you like the book so much.
It's fantastic. I mean, there's so many gold nuggets in there. I just think every practitioner, if you're going to do any kind of, I'll say traumatology, do you think that's the right word to use?
Yeah, traumatology, sports medicine.
Yeah, sports medicine.
Some of it, of course, the tooth book doesn't get so far into the orthopedic aspect where it's a chronic injury, but it does play into it. And I've had people write me who had success with chronic injuries using the book.
Mm-hmm. Yeah, it's fantastic. And I know it's geared somewhat to the layperson, but that shouldn't let any TCM practitioner stop them from getting that book. It's fantastic. Tom, there's kind of a movement in TCM now. I don't know if TCM is the right word, but there's a movement in the Chinese medicine community where some of the qi as energy concept is getting questioned by some new scholarship and certain practitioners. And I wanted to get your perspective on what, in terms of acupuncture, what does qi mean to you?
Ooh, that's a tough one. I think qi is complicated because I think the Chinese are using it at multiple levels. So there's people on the internet saying, well, qi is really the use of oxygen to break down molecular bonds and create energy in the body. Clearly, that's part of qi. Clearly, it does have to do with the breath and is to some degree synonymous with the breath. But clearly, it also has to do with myofascial chains in the body and some kind of movement that passes through those chains, whether it's fluid movement, whether it's a communication network like many people think. And it seems to me the Chinese, on purpose or culturally, hedge their bets with the definition because qi can be any of those things. From an orthopedic perspective, I look at it a lot from the martial arts perspective of the three internal harmonies, right? We have the intention moves the qi, or the heart and the intention are linked, the intention, the qi are linked, and then the qi and the force, or in this case we could say the movement, are linked. And it's that harmonious movement that happens in one moment, it's not a 1, 2, 3, that creates efficient motion, right, or normal motion. And I think a lot of what we're interacting with is that when we are treating people, right, this break that occurs between the heart's movement to create the intention to drive the qi in a certain direction and create a movement or a force. And so that includes the concept of course, oxygenation, but it also includes something that's very myofascial, muscular.
Possibly proprioceptive and things like that.
Yeah. And I think we're seeing, too, in the Western field that a lot of the chronic problems people have are proprioceptive problems, right? That strength alone doesn't do it. It's some kind of intention connection between the mind and the feedback loop between the part of your body that's injured and the nervous system, or for lack of a better word, right? That actually has to do with healing. And so I think the concept of qi encompasses all those things. And certainly energy is not really what qi is, but there is a notion, right, that if you don't have enough vital force, you're depleted, you're deficient, you're pale, and that is kind of energy, if you will. It's not just energy, right?
I heard, I don't know if you're familiar with Mike Sigmund. He was talking about he thinks in the fascia, there's a kind of electromagnetic aspect maybe to the fascia, and that may be the basis for the energetic part of qi.
Yeah, I've
And
read things.
I haven't looked enough into that to have a, competent opinion about that, but
No, I think it's a valid theory, right? It's definitely a valid theory, and he's responding to this kind of the thing you're talking about. This idea that is just one of my pet beefs, which is probably what Mike is reacting to, is this idea that there's these energy lines in the body, as though the energy just moves on that, and it's unconnected to the flesh and the muscles and the fluids running through it. And clearly, if you read Wang Zhuyi's book, even on channel theory, he says it's like a river, but it includes the fish, the banks of the river, the mud at the bottom of the river.
oh, that's a good analogy. Yeah, that's a better analogy. I think that's a more holistic analogy.
So I think that's actually a here's a channel-based guy saying that, right? But yet, I'm not sure that their treatments reflect that. I'm not sure because I don't know his system really. And many people who talk about channel theory seem to treat it like it's an energetic line and not like the riverbank, right? You can't just put more water in the river. You have to have the banks a certain way. It can't be too high on this side. There can't be a leak somewhere, right?
Yeah, I think that's a good analogy. And today I really wanted to pick your brain too about shoulder problems. And
so is that because it's hard?
yeah, the shoulder. I tell my patients this when I see a shoulder patient, that the shoulder's the most mobile joint in the body. There's no other joint can do that circumduction motion, and so it's fraught with problems. It really is. And what's the most common problem you see with shoulders, or the most common contributing factor, maybe, like in terms of muscle or alignment, or which direction you want to take this question?
I'm going to not go with the Western diagnosis because I don't use that much,
Okay.
and I don't use muscle tests or
like orthopedic testing.
The orthopedic tests. I use the TINA tests, which come out of also martial arts, which is like what's the normal range, what's the shoulder supposed to be able to do, what parts of that is it not doing. So I would say, for me, many problems that get put under tendinitis, torn rotator cuff, separated shoulders, labral tears, are misalignment problems. And not just that the bones are misaligned, although that's often true, but in the shoulder, because as we know, the bones aren't really what's holding it all together. It tends to be soft tissue that's not misaligned and also not tracking properly as it goes through the range of motion. So sometimes it looks like it's aligned, but when you have your hand on the shoulder and you're rotating it, you can feel that the soft tissue is slipping over bony prominences, or it's caught, or like, for example, a very common problem I've seen a fair amount of that's fairly treatable, often in one treatment, is when the long head of the bicep slips out of its groove.
I see. Yeah.
In Western medicine, there's virtually no treatment for it except surgery, but you can with simple acupuncture manipulation often fix that in one treatment, and that's an alignment issue, right?
And so from that perspective, what is one of the most common contributing? Would it be from the muscles in the back of the shoulder, the front of the shoulder, or
I think it's muscle imbalance is a really thing.
And what would you consider to be I'm sorry to interrupt. What would you consider to be the most common muscle imbalance? Is that a fair question?
I'd say, well, one is just neck tension. That pulls the whole structure out of alignment, right? Because the shoulders are hanging off the neck muscles, and the shoulder girdle and neck kind of
closely related, yeah.
Jungu Tuino, we kind of liken it to a bridge, a suspension bridge. Right? If the cables are twisted, then somewhere down there on the roadbed, you're going to have a twist in the roadbed, or you're going to have something that's not smooth, right? So I'd say neck tension in modern life is a huge one. So many people's heads are too far forward from using computers and electronic devices, and that throws their shoulder position off. Once my ears are forward of the points of my shoulder, then I cannot use the shoulder properly. It's literally impossible to use it properly, and so you're setting yourself up for a problem. Overdevelopment of, very common with people who do sports, they overdevelop biceps, triceps at the expense of the intrinsic muscles of the shoulders. I'd say that's a really common problem. Or overdevelopment of the trapezius muscles, which then create a tension on the whole shoulder alignment. But often it's just a simple, like, the muscles in the front of the shoulder are pulling it, and the chest are pulling it forward.
Pulling it anterior, like the pectoralis. Yeah.
So the person's like this. How can they, their shoulders are forward, then the shoulder can't rotate properly.
Right.
And so often it's correcting those things that in the end is going to affect the result you want. Now, that might not be the first thing you address. In terms of having them do exercise, you're going to address it in your tween-on, what muscles you release. And that's going to be mostly localized treatment, right? I mean, you have a shoulder problem. Our kind of approach in Jungu Tween-on is we start at the neck, and you have to do the whole arm with the focus on the shoulder. And you have to also look at their upper back. And you might have to look at their opposite hip.
Okay.
So we start with the local, and then we see if it takes us into the global. If it's a chronic problem, we can bet that there's misalignments going through the back or compensatory reactions in the body.
And is that process, that's a multiple appointment process, or is that happening all in the first visit?
It depends on, for me, that would be the first visit. In those assessments, we might treat all those things. But then again, I'll spend an hour and a half sometimes with people.
Wow.
First visit, and I right now I'm not treating clinically, except a few friends, and when I teach. But I usually had assistants to help me do some of that. So you start with this tween-out protocol. Let's loosen this up, loosen that up, and then we'll see what changes and go from there.
And so the initial treatment part, say, would be you'd be doing tween-out of the neck and shoulders and arm, and during that process, one, it's therapeutic in its own right, and then two, it's helping you to diagnose also.
Exactly. Yeah. Exactly. So I use it as what does it release and what does it not release. Then the acupuncture can be much more specific. Because,
I agree.
Whole channel, because I've already done that. Use the needles maybe to do more what I would call anatomical acupuncture, where it's working around the structures that I want to affect specifically. Or I can use the acupuncture to do big connections between, like, the upper back, lower back, right shoulder, left hip. And obviously you could do that at the same time as the anatomical specific acupuncture.
Thank you for listening. Watch for Eric's book on advanced Ashi acupuncture techniques. Don't miss being notified of its release date and when the latest blogs on useful clinical tips and techniques are posted. Stay informed and up to date by signing up now at our website, ashi-acupuncture.com. Now, back to the program.
And so commonly when you've done the tween-aw and you find some tights that haven't been released from the tween-aw, and you know that's the place to focus, and then you'll do anatomically specific acupuncture at those points. That would be part of it anyways.
You mentioned supraspinatus tears in the questions you sent me. So I find it more effective if you can actually needle under the acromial process and get the tip of the needle near where you think the problem is. If it's the supraspinatus, then I want to thread that needle along the fibers of the supraspinatus.
Right, from like SI13 or LI16, something like that.
Yeah, something like that.
Yeah, I do the same thing. I'll use about a 4-inch needle typically,
Yeah,
and try to get it deep in there. And then sometimes you can come from Li15 or
sure.
yeah,
As long
those points and go under the acromion that way.
as you can prop the arm up to get in there.
Yeah, there you go.
And I think a lot of acupuncturists don't think about the alignment of the fibers. I think that's often a problem, is fibers get kinked or twisted, or we get small tears that kind of pop up like like a ball of yarn that's a little unruly. And what I don't think they also realize is that by needling along the fibers, you can get them to realign.
Yeah, I see.
And you can sometimes do that with Tuina, you know, by ironing the fibers out with different techniques.
It's just hard to get under that subacromial space with Tuina, right?
That's where needles come in, because you can reach places that you can't touch, right?
Right. When you use that analogy of the fiber kind of balling up, it made me think about how what's broadly termed impingement syndrome, where there's some structure that in that subacromial space is getting pinched, typically at that 90-degree arc, and how that could be playing a role, what you said.
So we can sometimes use manipulation to get the fibers back, right? If the chest is pulling the shoulder forward, by opening the arm out, as we work in here, we can realign the fibers because that fan of the pec muscles opens up. We can also use needles, and it's a question of which will be more effective. Partly, it's can you reach the structure? So
Right.
yeah, like subscapularly, we can get our fingers pretty deep.
Right.
And we can approach it from, you know, the front or the back, but sometimes you can't get to that middle piece, and a 5-inch needle
Yeah.
will release that in a second, you know, in a way that you could spend 20 minutes with your hands and achieve nothing.
Right. I agree.
It's that interface of what tool to use at the right time.
But in general, if you could release something with Tuina, maybe that would be your go-to thing first, and then acupuncture. Is that right?
Yeah, and it's a question of time. If I'm not releasing it in a few minutes with the Tuina, which is how it should work, then I'll say, okay, maybe we need to needle it, because it has a slightly different effect. You know, you can get a little more of that penetrating effect through the fascia or through the meridian, and you can reach. You can sort of get things at a different angle than with your hands. So sometimes I'll go to that if it's taking too long with the Tuina.
And I want to interject for the listeners, all the techniques Tom's talking about, you can learn from the site Jungu Tuina. You can, jungutuina.com. I'm going to put a link below. I've taken some of their classes. I can tell you they're excellent, totally clinically relevant. And I encourage all practitioners, if you are interested in this stuff, Tom is a great person to learn from. So I'll put a link below.
Okay, thanks.
Yeah.
Yeah, we actually have two, and I think we're writing a third orthopedic acupuncture class where we specifically do these anatomical techniques, because we don't need to teach channel acupuncture. There's plenty of people that do that.
Yeah, right. Yeah, there's a plethora of stuff like that. And I'm almost done with my book. I'm going to send you a copy when I'm done. And it's all orthopedic acupuncture that I learned from my mentor. Talking to you about the way you needle, it sounds really similar to the stuff I'm doing when you're talking about subscapularis and supraspinatus. I think there's.
I do that, but I do it this way.
Yeah, right. But part of my goal with my website is to get this stuff out in the open, so we can all pool our knowledge and have a knowledge base that's going to grow and grow in the future. I want to be a part of that, and I know you do too.
I mean, it's how Frank and I created Jungu Tuina. We just got together and was like, oh, you learned kind of how I learned. Hey, what do you do for this? What do you do for that? And suddenly it was a class, and that class led to others. So
we're all fortunate because of that.
Well, it's all about the dialogue between practitioners, right?
Are there any shoulder problems that you have trouble with that you can't seem to help? Are there surgical cases in your opinion? And
yeah, I mean, I've seen a guy who was on the subway and somebody pulled the emergency stop, and he was holding on the pole, and it pulled his arm, and then he got up and was like, wow, that doesn't feel so good. And then it happened 5 minutes later, the brake pulled again. And, when he came in, you could see there was this unnatural space in his shoulder. And I said to him, like, look, I'm pretty sure your labrum is torn. And probably those ligaments, I think there's some ligaments behind the labrum that hold it. I think they're torn. And sure enough, he needed shoulder surgery. And then we did acupuncture after the surgery, and he's got full use of it. So you mentioned earlier you mentioned full width tears of the supraspinatus or of the meniscus, or those bucket handle tears of the meniscus. You can heal them as quick as they tear.
I see what you're saying.
With acupuncture, like I've treated lots of meniscus injuries and they get better, people are functional. But in those cases, it's like every time it locks, they tear it more. And that happens much more quickly than you can realign stuff or build back the synovial fluid. And so at that point, I think surgery is worth it.
I see.
Want to be active. And the same with with supraspinatus tears. There's pretty good results with surgery if you do it in conjunction with acupuncture.
Right. They need acupuncture before and after for sure.
Yeah. And the whole thing too. So it's.
Yeah, my mentor, he taught me that if you do acupuncture before surgery, a lot of times it can get rid of some of the scar tissue in there, and it's easier for the surgeon to do what they need to do.
Yeah, and if people take Yunnan Bio, sometimes there's less bleeding during the surgery. There's a lot of things, simple things people can
trauma pills afterwards.
Well, it depends. I usually go with something a little lighter than the trauma pills, like Resinol K or something like that.
Oh, I see.
Just because that Ma Huang can push the blood really strongly through the superficial layers, and you're not.
I see.
Depends on the surgery and the strength of the person.
Is there, Tom, is there anything you'd like to add about the shoulder that might be useful for our listeners?
I'm a big believer in rehabilitative exercise. I like the Qigong type of exercise. There are physical therapy movements that are more in that direction now because they're more about proprioception, range of motion, and less about just, let's just strengthen all the big muscles so it's all locked in, right?
And you cover a lot of that in the Tooth from a Tiger's Mouth.
Yeah, I cover a lot of those, the basic ones that I use in the clinic. Generally, there are those patients who will do a whole involved routine, but for most people, I keep it simple, 3 or 4 exercises. In the case of a rotator cuff tear, I'll often have them do some simple strengthening early on, and then later it's more about the proprioception, the range of motion, connecting the movement of the shoulder to the rest of the body so that they don't re-injure it. I think sometimes the strengthening method, so your deltoids get big and all these muscles get big, but you don't really learn to reconnect the shoulder to the center of the body.
Yeah, and from the way I understand it too, when people have active trigger points, that baseline level of tension in the muscle, it throws proprioception off.
It makes sense.
And then they can't stretch and strengthen it the way a normal muscle can. So they're just, yes, maybe they can get some hypertrophy in this, malaligned muscle, and but it may not be a good idea.
Well, it usually creates a bigger imbalance in the end. It's kind of what you're saying, I think.
Yeah, makes sense. Tom, I really appreciate you sharing your expertise with the audience. And,
my pleasure.
I just want to mention again the website jungutuina.com and your other websites internalartsinternational.com.
Yes.
And I'll put links below in the video description below so people have access to all that.
Okay, great.
Yeah, thanks again, Tom.
All right, it's been a pleasure. Thanks for having me on the show.
We hope you've enjoyed this episode of the Ashi Acupuncture Podcast. We'd like to hear from you. If you have a question, topic idea, guest idea, or a particular technique you'd like to hear discussed on the show, contact us at our website, ashu-acupuncture.com. That's ashi-acupuncture.com.